My talk is going to be a little bit of a bridge after Tim's great scientific talk. It's going to be a little bit of a mix of an overview, but a mix of a scientific talk. And I want to start out with a historical perspective. So the state of monitoring health has changed really considerably, and it continues to change extremely rapidly. And we have lots of different ways to measure physiological health, and so I want to pick just one aspect of it. So this is a picture from 1887. It's a demonstration in the Royal Society in London. A physiologist gave the first public demonstration of a heart measuring device. But let's fast forward several decades to the 1960s. The state of the art for collecting pulse information, heart rate information, was a medical professional, in this case a nurse here, checking heart rate using a mechanical watch in her hand. The state of health devices have obviously come a long way since then, right? This is something that you might find in a clinical setting. You have consumer-grade devices, and we can have a long discussion over the quality of data that comes out of these clinical-grade devices versus medical-grade devices. But these are things you can get at your local drugstore, online. You can buy your Apple Watch or Android Watch. But these things are readily available to collect this kind of information. A little bit more recent in the research world, although it's now moved out of research into product, you see the use of imaging technologies. So on the left here, you see an app that allows you to hold up your phone to your face using the front-facing camera, and it's looking for variations in color in your face and motion of your face, what your pulse rate is. And on the far right, you can see someone putting their index finger, up to the rear-facing camera of their phone, and again using imaging information to detect pulse rate. And so the big thing I want to point out here is that these vary in their use of AI. These are all digital health systems, but they really vary in their use of AI. So what we see from most of these devices here, particularly ones on the left and middle, there's not a lot of AI. This is signal processing, and this is data science, right? Arguably there is, and not arguably, there is AI built into the Apple Watch, not necessarily due to the heart rate, but certainly other mechanisms. And there is AI built into these two different kinds of techniques. And so what we're seeing is, as there's a greater proliferation of new and advanced technologies coming out of the digital health realm, the application of AI is becoming much stronger. But we have lots of sources of health information. Sean talked about genomics. We have access to electronic medical health records, electronic medical records, or electronic health records. This is data that's either manually or automatically entered into these repositories. We have medical devices that range from manually entered data to automatically collected data. We have telehealth devices that allow a medical professional to engage with patients at a distance through video conferencing and a range of remote monitoring devices. But then we also have connected health devices. And see, these tend to be a little bit more consumer grade, commercial grade, that allow individuals to keep track of certain aspects of their own health and wellness. A subset of connected health devices are implantables. Now, these are not necessarily there's in part to allow individuals to take to follow and track what's going on inside their own body. In part, it's to control what's actually happening in their own body and to provide information to medical professionals. And these devices are becoming more and more capable of being controlled by and delivering information to remote systems. They're almost all internet-enabled these days, for better or for worse. And then we have the devices that we don't even think of. We don't traditionally think of as health devices. I talked about the watch before, and we certainly think of aspects of it as being a health device. It can count our footsteps, it can track our sleep, it can tell us our blood pressure, but it collects a lot of data that I think on the surface most of us wouldn't consider to be related to our health. Phones, again, we talked about some aspects of your phone that can collect information about health, but again, they're full of sensors that can collect lots of different information. A lot of smart devices can have the potential to collect information. In this case, we're looking at smart speakers, smart earpods, or earbuds. Applications are apps, like to follow up on what Tim talked about with respect to social media in particular, and even smart cars. All of these have the ability to collect information about us as individuals and at the population level that can actually be tied to one's concept of health. And so across all of these systems types, whether they're medical or consumer devices, applications or websites, in your car or on your wrist, a growing amount of AI is being applied to make sense of these signals that are increasingly available. So we live in this world where the promise of computing embedded everywhere is really coming true. We have smart devices that pervade our lives, and I've shown a few of those on the preceding pages, with millions of new devices being sold every day. And these smart devices are constantly and passively collecting data about us. However, most of the data is discarded as irrelevant. But if we can apply AI to those, these can actually serve as a rich source of medical or wellness data. So in practice, what can we do with this data? I'm going to talk about three things. These are very high level, going to be pretty obvious. But with AI, we can use AI and apply it to this kind of behavioral data, this kind of digital health data to describe, to detect, and to predict. So take this example of an autonomous vehicle and what it might see through its sensors and examples. This is not a health example, but it helps to illustrate the points a little bit more clearly. So for description, the first way we could use data from a wide range of health systems and devices is descriptive. We can have them use which statistics can say why one particular set of students have mental health concerns and another does not. We could look at this, use it to describe the status of a particular patient, like whether they're ready to be discharged. In this image of an autonomous vehicle, a description would include the different objects in the scene and where they're located in that scene. We can also look at detection. So we design and we build novel machine learning techniques, many of the people in the room do this, on the data from these smart devices to detect an outcome of interest. And in my work, it could be whether a student is currently suffering from depression, whether a young student is currently binge drinking. And in this scene, the car could detect that the bicyclist is in its way, so it shouldn't autonomously drive through the intersection. The last step is to predict. So we use other machine learning techniques and AI techniques to predict in advance that unless that someone is going to have a health issue, either later today or later this week or sometime in the future, unless an intervention is deployed. Or that a student will be experiencing symptoms of depression in the future or something like that. So in this scene, the car might predict that the pedestrian is going to cross the street in front of it. So she is going to take a right turn in front of it, so the car should slow down and possibly even halt. All three, description, detection, and prediction, are critically important for understanding and explaining health behavior, to understand a current state, and to predict likely future state. And AI obviously plays a large role in all of this. So that's a little bit of an introduction to the state of digital health. The different devices and systems that can collect health and wellness data and how we can leverage AI to use some of this data. In this next part of the talk, I'm going to focus a little bit on the smart and connected devices in particular that we have all around us. It's the area that my research group has been focusing on the last 15 years. So these smart devices, they're pretty amazing, right? We carry them all in our pocket. We spend hundreds of dollars on these. But the amount of power that these have is pretty incredible. So they have sensors, and you can see a huge list of these sensors in an average phone. To detect data, they have intelligence to interpret that data and act on it, and to communicate that data to another device or another person. That's true of smartphones, smart watches, smart speakers, along with a whole other range of smart devices. Each of these has an operating system, a little piece of software running on the devices that chooses which sensors to enable at any given time, to collect data from, which data to store and which to throw away, and what actions to take based on that and what data to communicate. However, most of these devices collect the data and throw it away almost instantaneously. For lots of privacy reasons, it's what we want to have happen. But they throw it away really quickly, almost as quickly as they collect it, because the data isn't relevant to the task at hand, right? My phone needs to know, just for that millisecond, what orientation it's in, whether it's in portrait or landscape, so that it can make a decision about orientation, but then it throws that data away completely. The fact that I might be moving my phone around, by shaking it because my hand is shaking, or just because I'm gesturing, it has the capacity to collect that information, but again, it's not really relevant because I don't even have the phone open. So with a very tiny bit of extra software that we can add to these smart devices, we can actually enable all of the sensors, and we can collect data from all of them. And there are some good reasons why you might think about doing that. So What happens if we didn't throw away all of this data? What if every object we interacted with was actually a smart object and could collect information about our interactions and share that data about us? Now, I know that could be a really creepy thought, but because you don't know how that information is going to be used and how it could be used to harm us, but there are some positive uses of this data, as I'll talk through in a moment. So this is an image here of many objects that we might interact with on a daily basis. And we don't tend to think of any of these devices as smart devices, but what if we actually could make them smart? And what this would mean, this is fundamentally a multimodal AI problem, because we need to add sensing, intelligence, and communication. We have to think about how these devices are all going to work together to inform us about some broader health or wellness situation. And we have to understand how to apply data science and machine learning techniques to perform the acts of description, detection, and prediction. And what we want to do with this machine learning is to try and image a person's behavior and their routines over time, so as a kind of behavioral X-ray. So particularly if it's this kind of technology, it could be well regulated. So rather than thinking about an image that lets us know what's going on in our side of our body, like an X-ray or an MRI, instead, what if you could create a data image, which is an image of our behaviors? So we can leverage advances in machine learning, huge amounts of passively collected data from these smart devices all around us, and we can capture an image of individual and group routines, as well as anomalies from those routines. And just like a medical expert can detect cancer from an X-ray, a machine learning expert may be able to use these kinds of behavioral X-rays to do their work. So I'm going to jump into one of the projects that we had worked on quite a long time ago, really uses marginal amounts of AI, but gives you a sense of what you can do in terms of deploying mostly passive sensing information in the background. So this is a project called DwellSense. It was done by my PhD student, Matthew Lee. It's a project that was investigating whether clinicians could more quickly identify cognitive decline in an elderly population that was at risk for decline, but had no diagnosis or indication of current decline. And I'm just going to go into surface levels on this project. So Matt looked at activities of daily living and tried to identify which tasks could be easily sensed at scale. You see medicine taking, doing the laundry, reading the newspaper, staying on top of current events, bookkeeping, making sure you're in charge of your finances, using the phone, keeping a diary, cooking, making a cup of coffee. So here, our goal was to look at what tasks could we reliably collect information from using neither Matt nor I are electrical engineers. So we had to pick some tasks that we could reliably build sensing technologies for and to deploy in a number of people's homes. And the basic intuition behind our approach is that elders often transition from successfully performing activities with no intermediate mistakes or difficulties to successfully performing activities where they are making some intermediate mistakes, but the outcome is still positive, to finally unsuccessful performance. As individuals and loved ones of elders, we usually only recognize the problems when people are unsuccessful at meeting their goals. So the intuition here is, can we detect earlier in the process when there are more opportunities to affect change? So Matt looked at three of the activities of daily living: medicine taking, making a phone call, and the coffee maker. You can see in the top left here, the medicine, we got a $5 medicine box from Rite Aid, not a lot of sensing technology in the front. You can just see a tiny bit in the tops of the lids. Most of the technology was shoved in the back, so we get super glued together this is all Rube Goldberg at this point. But we super glued two medicine boxes together, and the kind of things that you can sense from this, pretty rudimentary but pretty valuable. You can tell what day of the week someone opened. You could tell whether they took the pills out of that particular day. You could tell whether they were struggling to open a particular, because with an accelerometer you could tell whether the pill box was shaking. So some pretty straightforward things. On the phone, really simply, he was looking for missed dials. So the idea that you might dial the first 3 digits of a phone number, realize you made a mistake, and dial again, just as a check on cognitive ability. And then the coffee maker, we chose the coffee maker because it was something that all of our elders in our study drank. They drank coffee. We replaced their coffee maker with our own coffee maker that we were able to instrument to just track different aspects of the coffee making process. This is a sample image from one of our study participants' homes. You can see she was a crafter, so you can see a lot of crafting supplies on her coffee table, the medicine, the pill boxes on her front table, and the laptop that's collecting information is hidden behind her TV. Now, we deployed the sensors the study happened over the course of a year. So our participants were in our study for about a year. For the first few months of the study, we only deployed sensors. We didn't deploy anything else. But after a few months, we then gave them a non-interactive tablet that we just mounted on their walls or put on a bookshelf. And they had this to access during the remainder of this this year-long study. And I should say that this study, along with many of the other projects, all the other projects I'm going to just briefly touch on, really dealing with small population sizes. So everything I'm talking about should really be taken as more as proof of concept and a step on the path to real working systems. So in this tablet visualization, what participants saw was what happened in the previous day. So today's Monday, so what they would see today, they would see what happened on Sunday. In the case of this visualization, today's Wednesday, and so they would see what happened on Tuesday. So at the very top, they can see that they took their morning medicine on time at 6:20, but they made two mistakes. They opened the Sunday door, they opened the Monday door, and then they correctly opened the Tuesday door. For the evening medicine, they just forgot to take it. Missed dials, they made 8 calls, 2 of those were missed dials. They correctly made their coffee as they had planned, but they repeated one of the tasks in between. So it provides them this information about how they performed the day before. And it was interesting to see the impact of having these displays in people's homes. So I'm going to walk through a slightly complicated graph up here. At the top here, we have participant 1, and below we have a second participant. Treat each vertical column, I know it's hard to see these columns, but treat each vertical column as a single day. So think of this grouping here as morning time and this grouping here as evening time. And so what we can see here is that, when did somebody take their morning medicine, when did somebody take their evening medicine, if they were late in taking their medicine, or if they just completely forgot to take their medicine. And so you can see with participant 1, morning medicine was kind of taken over a period of several hours throughout this 2 or 3 month period. Made several mistakes, either taking it late or forgetting to take it. Participant 2, it was much better, much more normalized. I guess dinner time was at a particular time, so it was easier to keep track of. And really, only seeing a single mistake there. Participant 2 only had morning medicine, and you can see, a fair number of mistakes there as well. This is what we were able to sense with the technology that I just described, the Rube Goldberg pillbox. But once we put the displays in place, it was interesting to see how people's behavior changed. We saw a lot more regularity in the timing when people took their medicine. Almost no mistakes. You can see a mistake here, a mistake here, a mistake here. So 3 mistakes compared to, quite a range of mistakes that we saw over the preceding 3 months. We also saw improvements with participant 2 who only had the morning medicine. But as the study went on, they started to make more mistakes. Now, the display was not intended to be a reminder device, but it must have had that kind of impact on people saying, I can see how I performed yesterday, now let this serve as a reminder for me to change my behavior in the future. But I think from a research perspective, what was really interesting to us is that we could see that the mistakes that people were making were really well correlated with a mini-mental state examination, which is something that an occupational therapist or a clinician might perform to understand how whether someone's undergoing some form of cognitive decline. And so with that strong correlation, you can imagine, well, now we can do automated, frequent, almost continuous tracking of someone's cognitive ability with pretty cheap technology that we can deploy in their homes, with the idea that an occupational therapist who has far too many clients to try and serve could then be directed to those that might need the most support at any given time. I want to just walk through one more quick example from this study that shows the value of something I believe Sean talked about in terms of monitoring and alerts. So here we had a person in our study who was in our study for about 6 months. You can see their medication taking behavior, and I'm focusing only on medication taking just in the interest of time, but the same applies to coffee making and the phone calls. So you can see here, making some mistakes, making more mistakes with the evening medicine, in terms of not forgetting to take it, but just taking it late, but nothing to be alarmed about. Patients seem to be doing well. In January, they had a bad fall. They were hospitalized, and they passed away. This participant in December and January basically stopped taking their medicine. Not quite stopped taking it, but was really erratic in terms of taking their medicine. This is a case where, I'm not claiming that AI would have saved this person's life, but this is a case where appropriate monitoring by either a human or an AI system to create an alert for somebody else to follow up on could have made a difference. I want to talk, just do a couple very quick, short dives into a couple of different projects that use much more sophisticated AI than in the previous project. So it's well known, well articulated what the challenges are with discharging people from the hospital when they're not ready. 13 to 37% are readmitted within 30 days of discharge. Costs to Medicare are in the billions of dollars. So with some colleagues at the University of Pittsburgh Medical Center, University of Michigan, and University of Virginia, we studied cancer surgery population, pancreatic cancer surgery population. We gave them a Fitbit, we instrumented their phones, and we started collecting data from them about a month to 2 months before they came into the hospital for surgery, looking at basically from the time of their pre-op appointment. We tracked them up to the point of surgery. Then when they moved to a recovery room, we started tracking them again. And we tracked them through up until 60 days after they were discharged. And our goal was to see, could we build a machine learning system that could be a better predictor of whether someone was going to be readmitted within 30 days? And the short answer is yes. With about 85% accuracy, we can determine whether any individual patient will be, again, small sample size, but will be readmitted into the hospital within that 30 days. And the key, we collected symptomatology, we had access to EMR data, we had access to a lot of things, but the key feature or factor that helped us build this model was actually the length of sedentary bouts. It wasn't how many steps they took that day. That was not very indicative while they were in recovery mode, but it was the length. The longer the length of their sedentary bouts, the longer they were lying in one position, even if they got up and walked 10,000 steps, which nobody was doing, but even if they walked a ton of steps, if they had really long sedentary bouts, that was a strong indicator that they were going to be, when they were discharged, that they were going to be readmitted. A second case that we looked at was looking at binge drinking. I mentioned binge drinking before, looking at this amongst a student population. I don't think I need to go into the challenges in this group about the challenges of binge drinking, particularly in a college population. But we were approached by a clinician. This is with collaborators at Stanford, Rutgers, and Stevens Institute of Technology. We were approached by a collaborator who was an expert in text messaging intervention. And he typically sends messages in the evenings, not surprisingly, on Thursday, Friday, and Saturday nights, because that's when college students tend to binge drink. And we collected some data, and we found basically the same thing, that a lot of the binge drinking, those are the orange bars. Blue bars are drinking, orange bars are binge drinking. Binge drinking tended to happen on Friday, Saturday, Sunday, actually over Thursday. And they tend to happen between the hours of about 7 p.m. till about 2 or 3 a.m. But using again a smartphone and a Fitbit, collecting data, looking at data over the past 6 hours, we could detect that a college student was currently binge drinking from their mobile phone with about 97% accuracy. What was particularly interesting to us is whether we could do prediction. So again, looking at that 6-hour window and then looking 1 hour in advance, we can actually predict that someone's going to binge drink in the next hour with 93% accuracy. While detection is useful because it allows for a lot of social interventions and negative behavior, prediction is even more valuable because then you can deal with the individual directly before they even start their negative behaviors. And the features here that were important were things like people who spent less time interacting with others were more likely to binge drink, while those that spent more time talking to people in that 6-hour period were less likely. And here our hypothesis is that the social support that students get by talking on the phone or interacting with other people is likely what's helping them avoid these binge drinking episodes. So the use of this kind of data to address this critical issue in mental health is really exciting to us. It was fascinating to me to be able to see that generally discarded data from our smart devices around us could be used to combat issues in mental health. So the last project I want to just briefly talk about, because it's the biggest one and the one that we're currently working on, is student depression, student mental health. And it's linked to issues of lower academic performance, students dropping out of school, and increased risk of suicidality. So same kind of data that we've been collecting before, smartphone and from a Fitbit, collected 2 years at my prior institution, Carnegie Mellon University, and now 5 years, going on a 6th year this spring. 5 years now at the University of Washington, with thanks to College of Engineering, the Allen School of Computer Science and Population Health, collaborators from Engineering Allen School and School of Social Work. And what we were looking at was a range of things around in student health: depression, loneliness, amount of sleep, belonging, how closely they felt they belonged to the university campus community, their physical activity, discrimination. We're looking at a wide range of things. But one of the most interesting things we're looking at is being able to predict depressive symptoms. So think of a 10-week quarter. And we used the first 4 weeks of that quarter to be able to develop a behavioral image of an individual student. And with that, we can predict whether that college student is going to be experiencing depressive symptoms at the end of that quarter with about 81% accuracy. Not accurate enough to really do anything with yet, but it's could grow into an early screening and intervention technique. And here we use student data. This shouldn't be too surprising. Students that are interacting more with others via their Bluetooth, as measured by Bluetooth, or application usage. Students who are spending more time or spreading their time out amongst a wide variety of locations, much less likely to be suffering from depressive symptoms than those that are not. So again, not too surprising, but maybe the fact that you can collect it from a mobile phone might be. So I want to end here with just a few challenges that are worth talking about. So with these great opportunities of combining digital health with AI come some challenges. Being able to build models that are interpretable. A lot of the models that we build in AI in general, these are challenges not just for digital health, but for AI in general, are black boxes. They're not interpretable. We want to be able to do take a more of a precision medicine approach and not build population models, and there are some strategies to focus on there. We also have to figure out how to generalize a model to other populations. So this is probably the major crisis that AI is going through right now, in figuring out how to take a model that's built for one population, have it generalized to another population, and how do we build models that are actually fair, and that work on individual small populations within your larger sample size. These are not the only challenges. Large language models improving, as Tim talked about, ChatGPT, this and that. We do have to plan for how we're going to integrate these technologies into the work streams of digital health. We also have to think about the ethics of using AI to inform decisions, make decisions, to monitor, to create alerts, or even to provide direct interventions. But if we take genomics, EMR, all of the devices that I talked about earlier in the talk, apply machine learning, we are pretty good in our fields of creating interpretable or personalized or generalized or fair models. We're not very good at doing all of those at the same time to produce these positive outcomes, and so that's what we really need to be focusing on. So just to conclude, I think that there's just a tremendous wealth of opportunity to use devices that are both traditional digital health devices as well as devices we don't think of as being traditional digital health devices, combining it with AI to improve health and wellness. A fully connected world is absolutely going to bring other challenges that we're not quite ready to deal with yet. And translating that to an intervention to think about human in the loop or AI in the loop, as Tim referred to it, is going to be really challenging. But we can produce systems that can have societal impact.